disparities in access to quality parks and recreational facilities. A systematic review. Research conducted by this systematic review looks to investigate the different factors contributing to disparities in parks and recreational facilities in low-income minority populations of the U.S. With research indicating low physical activity and increased sedentary lifestyles for this population, the research question is there a significant association between obesity rates among low-income minorities and their living proximities and quality parks and recreations? With the health belief model, there's an applied framework used to construct prevention strategies in combating the disparities in the target communities. This entails that with the community individuals informed and educated on the importance of quality centers for physical activity, that this leads to better health results for the families, specifically the youth of the community. Also, an assessment of the research methods to detect distances from residents to parks and recs were used to determine which resulted in more accurate data. For studies included in this literature review, there were strict guidelines to retrieve the much needed information for this study. Criteria included studies published within the last 15 years, studies based in the US, studies used a unique method for measuring spatial areas from communities to parks and recs, studies examined factors contributing to these disparities in the access to parks and recs, and studies examined different communities around the U.S. There were 9 total studies included in this systematic review. 7 were quantitative, a mixture of cohort and observational researches. The other 2 were qualitative, observational researches. While no randomized control studies were found matching the full criteria, these studies focused on methods and designs for measuring spatial identities in the target communities. Limitations existed in lack of research examining actual low-income minority communities compared to racial ethnic communities. Even though the two terms are heavily associated, the categories are different. One can exist by themselves. Although factors for disparities were identified, they were not explicitly studied in detail to determine whether there were associations between factors and disparities. Randomized control studies were needed to study community individuals and their perspectives. Future research requires that randomized controlled trials be conducted to examine factors in these communities using the health belief model as a framework. Using interviews and surveys, we will conduct research in the communities found to have disparities in access to public parks and recreations that will help gain perspectives and awareness of the individuals living within the communities.